I think most people are going to agree that truckers are essential workers, but what is the holdup getting them to that higher priority?
So part of it is the decision making by a committee that informs the CDC, and they're basing their decision on what they think will be most impactful for curbing the pandemic. So basically, they view truck drivers as being essential workers, but because they don't have as much interpersonal contact on the road, they view them as lower priority than, say, medical workers.
We know vaccination is important for everyone
Yes.
to curb the spread of COVID-19. But in your argument, why do truckers need to be elevated to that higher priority?
So there's several ways to think about that. One is they're a mechanism for distribution of dissemination. So we talk about who should receive it, but without truck drivers, they can't get anywhere. On top of that, truck drivers, they have lower interpersonal contact than a lot of the essential workers, but they also travel these enormous distances. They also interact with all kinds of different people along the way. So while they might not pose specific risks, maybe on a day-to-day basis with their interactions, because they travel so far, they could be really key vectors in potentially spreading the disease. So you have a driver who picks up maybe in New York where they're having an outbreak, then they travel all the way to California. They're going through every state along the way. And if they happen to pick up the virus, they could be spreading it to other people all across the country. So it's very important, really trying to control the pandemic. And even beyond that, these traditional public health strategies that we've seen where people are told to stay at home, we're closing local businesses, well, they don't really work with truck drivers because they're such a mobile population and they're essential workers. So we don't really have any actionable strategies yet for truck drivers that we can really meaningfully implement.
Got it. And you have unique insight because you spent time driving truck. What was your biggest takeaway from that experience, and how do you think it helps shed light on where we are now?
And it's really amazing because truck drivers, they're so stereotyped, they're so stigmatized, a whole profession. And so we tend not to see a lot of attention to them as workers in general, even though they have tremendous health disparities, they suffer tremendous environmental deprivation. I know on the road, like even before the pandemic, when I was a driver, like just getting healthcare on the road was nearly impossible because you can't just go into town in a truck. You're basically on island to island where you don't have access to medical care. So I think the pandemic has really highlighted the systematic deprivation in healthcare, even healthful living resources that make the population so vulnerable now. For example, healthy eating, physical activity, all these things have kind of built up now to make drivers especially vulnerable to the pandemic, and if they get sick, getting really sick.
Well, and that brings up a whole other issue. If they get sick, a lot of these folks don't necessarily have I mean, you talked about access to healthcare, but actual
Mhm.
like insurance. These are all contractors, a lot of independent contractors, and
Yeah.
so maybe they don't have that resource available for them as well.
Yes, you see a lot of differences. For example, you have drivers who work for big companies, they might have health insurance. You have drivers, like you said, are independent contractors who don't. So there's a lot of variation in even having healthcare to begin with. But even beyond that, even if you have healthcare, if you have no way to actually access it while you're on the road, then it's kind of moot, right? I mean, you can do it when you get home, but some drivers are on the road. For example, long haul truck drivers might be gone 2, 3, maybe a month at a time. And so you see a lot of self-medication. And if you're a driver who you think you're sick with COVID, what are you going to do on the road if you need to quarantine? Your company's not going to pay for a hotel for 2 weeks at a time. You might be 1,000 miles away from home if someone else gets sick, for example, in your family. So it's a very difficult situation, and we just don't have the resources or mechanisms to try to address it in truck drivers yet.
Was there anything else that you wanted to add that I asked about?
So I think that one thing I maybe would like to add, I think what we're seeing now when we think about the pandemic, and this is true not only in truck drivers' cases, but also in general public health, in that perspective, we view this as almost like an accident. But in reality, some of the disparities, some of the negative outcomes that we've seen, the high death rate, for example, is really a function of these long-standing issues in the healthcare system. And that's true of truck drivers, like I mentioned, for nearly 40 years, the health of the occupation has been going down, but also just in the big picture in the United States, like we're seeing some of these same patterns of health disparities that we've seen for other diseases and other quality of life issues for decades, if not centuries. So it's really just reflective of things that have been going on for a long time. And this is just a really profound statement of these longstanding issues.
Dr. Lemke, I appreciate you taking the time and providing that insight, because I think it is
Sure.
so valuable as we have this discussion about
Yeah.
who needs to be vaccinated next.
Yeah, and I'm sure people are going to have, I mean, I've been reading Twitter, some of the perspectives of people, and you know, it makes sense to vaccinate the most vulnerable. But my big point in that paper was just like, okay, well, we need to think about actually protecting the people who are getting the vaccines out to begin with. Because if we don't protect those people, whether it's medical people, truck drivers, manufacturers, nobody gets them.
Yeah, those vaccines aren't going anywhere.